Day goes by where healthcare issues don't hit the front pages of the newspapers. Rising costs, the quality of medical care, they are issues that affect all of us. 15 cents now of every federal dollar to health care, and how many people in this country are being wiped out not by their income taxes, but by the cost of their health care, which in many cases is utterly inadequate. To speak about this incredible problem, which may indeed be heading towards real serious and genuine disaster, is Joseph A. Califano, Jr. You know him. He's the former Secretary of Health, Education, and Welfare, and he's got some answers for us. And Joseph Califano, we welcome you to Good Day.
Well, it's nice to be here, Tom.
Mr. Califano, how have we gotten into this mess? What is at the root of these problems that we're in?
Well, I mean, we have an incredibly expensive and wasteful healthcare system right now. Nobody's really a villain. People were all acting for the best of reasons. I mean, the corporations and unions agreed to provide generous benefits, all skewed to the most expensive end, hospital care for their employees.
Right.
When we passed Medicare and Medicaid in the 1960s,
which you were one of the architects.
Which I was one of the architects of, and as I mentioned in the book, we had to agree to the doctor's insistence on being paid a fee for their customary fees, and hospitals being reimbursed on a cost-plus basis. The Blues and the insurance companies didn't regard
Blue Cross Blue Shield.
Blue Cross Blue Shield and the insurance companies did not regard themselves as working for patients or for the people who were paying their premiums. They really regarded themselves as working for doctors and hospitals, so they just passed the increases on automatically. They never asked any questions, and we've been going along this way. We gave doctors a monopoly over medicine, which was designed to protect people because we wanted to have qualified people delivering medicine, but at the same time it enhanced their economic status enormously. Moved to greater specialization, and then suddenly we had a system in which doctors by and large only get paid if they do something, if they operate. They only get paid to repair us after we're sick. They're by and large not paid to keep us healthy. The whole system skewed that way, and now my judgment of the $400+ billion we'll spend this year on health care, about $100 billion of it will be wasted. It will be to provide services that won't make anybody any healthier.
Well, you've touched on a million points. Let's pick up some of them. We're a pill-happy, crazy country. 77 billion prescription pills that you write about. Do we blame the excessive technology, the CAT scanners, which you say maybe we have too much technology? Do we blame the voracious financial appetites of doctors? Blue Shield makes $2 billion in profit, you mentioned. Do I go on?
Well, let's go try and deal with them one by one. I mean, on the pills, what's happened is, a tranquilizer is to ease our problems when we've been subjected to too much stress.
Right.
And get us over a temporary hump. The reality of what Americans are doing with tranquilizers is that doctors are prescribing them and patients are asking for them in order to subject themselves to even more stress. That's part of it. As far as the great technology is concerned, I mean, there are tremendous advances in health because of technology, but
many life-saving. Many of them absolutely life-saving.
But but we can use it more efficiently. Not every hospital has to have a CAT scanner. Not every we can all use one at the hospital across the street. Nobody has to have every single new tool that's out there. We ought to use them more efficiently.
But we're doing too many operations, you write in the book. In fact, if you come from some communities, you have a 4-time greater likelihood to have a tonsillectomy than if you come from another community.
It's worse than that, Tom. I mean, right here in Massachusetts, if you come from Fitchburg or Framingham or Fairhaven, you're 15 times more likely to have your tonsils taken out for tonsillitis than if you live in other parts of the state. If you come from Holyoke, you're 4 times more likely from Hingham to have a gallbladder taken out than if you come from Holyoke. Coronary bypasses, unbelievable. We have an epidemic of coronary bypass surgery.
You say that surgery is really just prolonging life. It's just a short time. Well, why are we doing it so much?
Well, only 11% of the coronary bypasses clearly help the patient.
Yeah.
And why we have so many? Well, if you go to a fee-for-service doctor, you are twice as likely to have a coronary bypass operation for the same symptoms as if you go to a health maintenance organization, 4 times as likely as your Canadian or European counterpart, and for a lot more money, incidentally.
All right. What do we do? Our 3rd child was delivered in London, national health care. We didn't pay a dime. It was fantastic, I got to admit it. What do we do? What's the solution? Do we move towards socialized medicine? What do you propose, Joseph Califano?
Well, I mean, I've got a whole host of proposals in the book.
Give us a sample.
All right,
yeah.
let me give you a sample. I think, one, we make our system more competitive. We take the big buyers of care, Chryslers, the big corporations, and they learn more about care. At Chrysler, we've been able to save $100 million in the last 3 years on our health care bill, and we've provided better quality care. How? We eliminated unnecessary hospitalization. We found out we now contract directly with laboratories. We let them bid to do lab tests. We've created special providers for dental care. That's one thing we do. Secondly, we tilt the system far more towards health care than sick care.
Preventative medicine.
Absolutely. And for example, when we go to a doctor now, we only usually go there when we really feel lousy. Well, we ought to pay doctors a certain amount a year, and their job ought to be to try and keep us healthy, to encourage us to quit smoking, to encourage us to keep our cholesterol levels in the right area.
Though they may lose money if they keep us healthy.
Well, we're paying them to do the wrong thing.
Right. That's the point.
Yeah. If we pay them to do the right thing, they'll do it. And is it important? Look, we've had the most dramatic decline in heart attack deaths in this country in the last 15 years. A 25% decline, as you know. Why? More than half of it because people quit smoking and changed their diets. Even the hypertension pills, the bypass surgery, the transplants accounted for a very small proportion of that decline.
Final question to you, because it concerns a lot of people. The DRGs, the diagnostic groups, some people say they're terrific. You get out of the hospital much quicker and much sicker.
Well, I think the system of diagnostic-related groups, paying a certain amount for each of 470 different diagnoses, with some variations for complications, that's a better way to pay hospitals than on a cost-plus basis. But what we have to do is provide nursing care at home for people who need it when they get out of the hospital.
Home health
That's
care.
where Medicare has fallen down.
You know, one thing that you say, as I mentioned in your book, is if we don't make the changes in the next 50 years because of the enormous increase in the number of elderly people, we are really heading towards absolute disaster in the health care program.
We are at the dawn of the first four-generation society in the history of the world. It'll be common to have 2 generations on Social Security in retirement, getting nursing care.
Here is the book. I recommend it to all of us. Excuse me. America's Healthcare Revolution. I'm getting choked up over this. And an interesting subtitle, Who Lives, Who Dies, and Who Pays? Joseph A. Califano, Jr. Thanks so much for being with us.